Hi everybody, welcome to episode 33 of the Teesside Business Podcast. Today we're very lucky to be joined by Nick.
Hi.
Sorry, is it Nick or Nicola? I forgot to ask that.
It's Nikki.
Nikki, okay. Always good to ask things. So, let's start off then by you giving us a brief career history of, what led you up to starting the business and everything like that.
So I used to be a nurse.
Mm-hmm.
I still am a nurse a couple of days a week, but
Okay.
I'm about to leave. My background is sort of acute care and critical care.
Okay.
And I left the NHS and went to work for a private company because the stress I was finding the stress in the NHS a bit much.
And it only seems to be getting worse and worse from
it
what.
does, definitely. And I work for a private company now, but I do a lot of writing and reporting and speaking to other professionals and things. It's a bit of a pen pushing job really, so I don't have much face-to-face, well, I have no face-to-face contact with patients or clients at all. And I work with an aesthetics nurse as well in my day job. And to be honest, at first I wasn't really interested because I think, like many people, I had the perception that that aesthetic work was all about big fat sausage lips. And,
Yeah, there is
and
that
things
awful
like
perception.
that.
Yeah.
And I think I became quite good friends with this colleague. And I've seen a lot of her work and hearing her talking about it, the things that she can achieve. Or that can be achieved in the industry for people with just a general ageing process. What a massive difference it can make. Sort of really got me interested in it, and then I started doing a bit of training and things, and that sort of led me on to training in other areas of aesthetic medicine as well. So I opened my clinic.
Oh, brilliant. And how long has the clinic been open for now?
February.
February? Oh, brilliant.
February.
How are you finding it?
All right, yeah. We've just moved in May into new premises because I think the initial premises that I had weren't what I was looking for when I was bringing other treatments and things in. So I've moved the business into a new premises in Hartlepool Enterprise Centre.
So
it's beautiful.
For those people who are listening, what is aesthetic medicine? And what's the main difference between that and, say, just regular, like, not beauty and stuff, but you know what I mean?
Yeah.
What are the main differences
So
there?
the main differences is aesthetic medicine should always be performed by somebody. Any kind of aesthetic medicine should be performed by somebody who is a medical professional, so it shouldn't be performed by anybody who is either a lay person or in my opinion, a beautician, or and the reason for that is that we're messing about with it, not messing about. We're changing the anatomy of the face, and the vasculature, the nerves, the muscle structures, and everything in the face it's absolutely phenomenal. Unfortunately, at the moment, there isn't enough regulation around the area, but I'm sure we'll talk more about that later. In aesthetic medicine, we don't just cover the kind of the lips and cheeks and things that I think is the perception of aesthetic medicine. We cover lost volume anywhere in the face, mid-face, lower face, hollow temples. We can make somebody appear more masculine, make somebody appear more feminine. If somebody has a particular attribute of the face that really bothers them, we can usually do something about it from a non-surgical perspective.
Okay.
We can look at skin, and this is beyond sort of the realms of a beautician. We can look at skin peels and collagen stimulating therapy, some dermatology treatments. What else do we do? A lot of sort of skin, obviously wrinkle treatment. Everybody's heard about wrinkle treatment, but I think everybody has only kind of heard of the frown lines and the cat's crow's feet in the forehead and things like that. But actually, what we can do with that drug is phenomenal. We can, if somebody has bruxism, which is where you either grind your teeth or jaw, and you've got quite a bulky jaw, we can actually relax that muscle, slim that down, and give a real long-term difference to somebody who maybe chews at night, grinds the teeth, things like that, clenches the jaw. We can relax muscles in the neck that cause wrinkles in the neck. Sort of as you get older, sort of the bottom corners of your mouth start to turn down. We can relax that, but only somebody who's very advanced trained can do these kind of things. So that's where you're going to see a big difference between what you're going to get sort of from a beauty perspective, what you're going to get from a sort of basic injector perspective, and what you're going to get from an aesthetic medicine clinic.
And it is something that's been, I think it was in the news recently, where I saw somebody who had been administering treatments that wasn't a medical professional, and obviously she, I think, got fined, or I don't know if she got jailed, but she got like a very substantial sentence. And I don't, like, obviously we don't want this to come across as, you know, beauticians are rubbish, you know, and that's not what it's about. But it's kind of, what are the like the main things that a beautician can do, and what's the line, like, for if somebody was looking for out there and thinking, well, it's okay for beauticians or trained individuals to do this, but it's not okay for them, where's the line where it should be a medical professional, if that makes sense?
There's two different lines. There's a legal line, and there's a common consensus line.
Okay.
So from a legal perspective, you could go and buy some dermal fillers and start injecting somebody tomorrow.
God, that's really scary.
Yeah. You don't need any permits, you don't need any licenses, you don't need any qualifications.
Yeah.
Nothing to stop you.
But that, like, as a consumer, you would think that, you know, that sounds scary to me.
It does.
You know, so...
Yeah, it is.
You know, like, you wouldn't want me injecting anybody, you know what I mean? Like,
but that's the way the law is, unfortunately.
Yeah.
There was a big review after the PRP breast scandal in... I've forgotten the date now, it's gone out of my head. I think it was 2014, the Keogh review. And they established and advised the government that it was a disaster waiting to happen, really, and that there needed to be some protection and governance in place. And they made a huge amount of recommendations, and unfortunately we haven't really moved forward from that. What the government are doing at the moment is they have set up another voluntary body. There's lots of voluntary bodies in the aesthetic industry, and I think the difficulty with the voluntary body is that anybody who is professional and is ethical will join a voluntary body, but you're going to get a massive amount of people who aren't and won't, and so they're not being regulated by anybody. In terms of sort of regulation, health professionals are all regulated by their bodies. So I'm a nurse and I'm NMC registered. If I hurt someone, I will have to stand up in front of the NMC and answer to what my lackings were, what my failings were, blah, blah, blah. And if you're not a medical registered professional, then you've really got no one to answer to.
Yeah. And I think that is a very important thing to kind of highlight, that not that people are under like that level of scrutiny, but there's like things in place to make sure that the level of care given is of a standard. You know, you wouldn't want to go see, you know, a surgeon or a doctor or somebody who's just learned about it from somewhere else. Like, you wouldn't want a pilot flying your plane that has just watched it on how to do it on YouTube. You know what I mean? You would want a trained individual.
Exactly.
So when it comes to that kind of thing, what kind of questions should people be asking, or what should they be looking out for when they're going to see a practitioner? So
when they're going to see a practitioner, they should be looking out for ideally a medical qualification and a medical registration. They should be asking to see training certificates. So for each procedure, there should be formal extra training in place on top of that, medical qualification. They should be looking for somebody who's insured. So a reputable practitioner will always have medical malpractice insurance. So that, heaven forbid, complications do happen. They're insured and covered for that, and any sort of further treatment that might be required. They should be asking about experience, and ideally they should be asking to see sort of before and after photographs and things like that. So or asking around whether the practitioner, what other people's experiences of the practitioner are.
And when somebody's speaking to somebody, whether they're making inquiries to different companies go see, are there any kind of red flags where if you ask somebody something and they don't know the answer or anything like that, which could help tip people off, right, this isn't the kind of person I want to go see.
I think if the company that you're speaking to or the individual that you're speaking to doesn't do a consultation prior to your treatment, that's a red flag. You should we're sort of guided by guidelines, and the guidelines really are that for consent to take place, there should be a consultation, and then there should be a cooling off period. Now that's not necessarily with all procedures, but every clinician should offer that.
Yeah.
So you should be able to come in, have a chat, have a bit of information, see what that professional thinks, what their opinion is of treatment, etc., etc., etc. You should be able to go away and think about that without committing yourself to anything.
Yeah.
And in an ideal world as well, you should be looking to have some written information to take away and read as well, to make an informed decision.
So one of the things that you said earlier were obviously like non-surgical treatment. For people who like aren't aware of the procedures and things are available, where a lot of people would think to correct, like, you know, you were talking about like relaxing muscles and helping like structure the face, like and I suppose a lot of other people would think that those are really like invasive or surgical procedures. What kind of like advancements have been made, or what can you do that people might actually think would be a surgical procedure, or, you know, plastic surgery or wherever it may be, that you can actually do now?
I think the line has been drawn quite recently by the Care Quality Commission. So any injectable treatment, so any use of dermal fillers, skin boosters, any needling, any muscle relaxant injections, anything like that is classed as non-surgical. There's a kind of a level up from that. Some practitioners, there's a quite new technology called pedio threads or thread lifting or cog threads, and that's where actual threads are inserted into the face and tightened to give a facelift, without actually going under the knife, but that is classed as a surgical procedure. So that's when you're getting into surgical, and for that to be happening, you need to be looking that the clinic is registered with the Care Quality Commission, because you can't offer those kind of services without registration. It's against the law.
So in regards to your own business then, what kind of clients are you seeing? Is it predominantly people for, you know, like you mentioned, elderly, who are like, or anybody who wants to fight the signs of aging, or is there certain things? Is there a class of people that go for certain things, or is it a bit of everybody?
I think it varies by practitioner. A good friend of mine is much younger than me, and most of her clients, or a lot of her clients, are young. Not young, but, you know, kind of the millennials. My clients, and I don't know if it's because of the way I work or because of my age, most of my clients are sort of mid-30s to sort of 60s.
Yep.
Mostly ladies, although I do see men and treat men.
Yep.
And it's mostly just wanting to wind the clock back a few years.
Yeah.
Where they're starting to lose a bit of volume in the face, where things are starting to drop and sag a little bit, where wrinkles are starting to form, or they're noticing them more. It's things like it. They're the majority of my clients, I think.
And for that kind of thing that they're getting, is that something that's multiple treatments, or a treatment that needs to be renewed every so often, or anything like that? Or
any sort of dermal filler, any injectable treatment will need repeating at some point. Unlike surgical, it isn't permanent. So the length of time between treatments for a dermal filler, just talking about dermal filler specifically, it depends on the viscosity of the product and where it's placed in the face.
Yep.
So there are different types of dermal filler for different areas. So you've got some that are quite thick, and you're going to want to put them, for example, in the cheeks where you're going right up against the bone. You need a really viscous dermal filler to make a difference, or kind of in the corner of the jaw there, where you're needing to see that volume. Some dermal fillers on the opposite end of the scale are really, really thin, really flexible, really fine. And they're the kind of dermal fillers you're going to be placing in sort of the little fine lines around the mouth area, filling very fine lines, that sort of thing. And the more dense filler has better longevity than the fine filler, and that's because of the way the molecules are cross-linked. So it's difficult to give an average of how often generally fillers would need doing. But if you take lips as an example, you're probably looking at 2 or 3 occasions in the first year, and then after that the longevity will increase, and that's because actually having the dermal filler in the first instance, they're made up of something called hyaluronic acid, which is it's a protein block and a building block of our tissue, really, and it absorbs water. It's phenomenal at absorbing water, so it multiplies in volume. So already having that in and having that bit of volume added in the first instance, and then the collagen stimulation that it creates, and it does create a little bit of scar tissue as well. As you layer dermal filler, and I always refer to it as layering, the longevity increases. And perhaps if you stopped treatment after a period, not necessarily after one treatment but after multiple treatments, if you decided not to get it topped up, you probably aren't going to go back to how it looked initially in the first place. You are going to have got some long-standing changes there.
And if somebody had originally gone to somebody who wasn't a medical professional and registered and things like that, is there a chance that they may have not been given a treatment that is as effective? Or like, asking if anybody, like, if there's people out there who think, well, I've been to see someone and they weren't ready to, I don't know if this is either right for me or suboptimal. Is there like a way that they can come and you can assess it or help? We
would always refer initially, if somebody's got a problem, we would always refer them back to the practitioner who did perform it from an insurance perspective. However, there are many, and there's a place in Darlington. There are charities and groups of nurses who kind of club together to help people. What I can say is that if somebody's had dermal filler in the past and there's been an issue, it's more likely to be an immediate issue. So it's more likely that you're going to, if there's a complication, that's going to recur. In terms of suboptimal products, there are a lot of counterfeit products available.
Okay.
And frequently products bought over the internet are either counterfeit or extremely cheap and not very good.
Yeah.
And you can dissolve dermal filler.
Okay.
Hyaluronic acid is dissolvable with a drug which medical professionals will have.
Yeah.
Non-medics won't have it. And that's for a safety reason. If there's a blockage anywhere or an occlusion, we need to be able to dissolve that straight away so that no long-term damage is caused.
Yeah.
They could potentially be dissolved, but that also kind of depends on whether it is a hyaluronic acid filler or what exactly has been put in the face.
Yep.
You're never going to be 100% sure if they haven't been to someone who's reputable.
So are there any new treatments that are coming out soon, or any on the horizon that you think might become widely available soon?
There's a few at the moment. There's
okay.
So there's a skin boosting technology that's really taking off, and that essentially crosses the gap between a dermal filler and a topical treatment.
Okay.
And it's phenomenal. It's hyaluronic acid, the same thing that builds our skin, and that is contained in dermal fillers, but it's non-cross-linked, so the molecules aren't linked together, so it's not a thick product. It's extremely fine. It's injected into multiple points in the face, and what that does is it attracts most of the reputable, and there is only a few brands have got this product out at the moment. It's so new. Most of the reputable brands will have amino acids, vitamins, minerals, all that kind of thing in with that hyaluronic acid. And injecting that into the face, it distributes underneath the tissue and plumps the tissue out, rejuvenating the face really from the inside, and sort of helping with fine lines and wrinkles and things like that. I think it's an absolute game changer.
That's phenomenal.
Another one that we're seeing crossing the pond, it's available. There's quite a few clinics down south do it. I actually do it as well, which is Mesotox, which is, or some people call it microtox, and it's using the toxin, botulinum toxin, that's used for anti-wrinkle injections in a slightly different form. Because the toxin was originally used in medicine, there's lots of evidence that it can help reduce sweating, reduce activity of the sebaceous glands, so oily skin.
Yep.
There's a lot of anecdotal evidence that it helps treat rosacea, for example. And so a different preparation of that is used and then needled into the top layer of the skin, so only into the epidermis.
Yep.
And the results from clients I've seen has been fantastic, and I think that's going to become more popular as well. It's very popular in some of the Asian countries, Japan and China and things.
Yeah.
And I think it's quite popular in America, but it has been for a longer time in America.
Yeah.
It's only just sort of hitting down here.
Yeah.
And the other thing I think, we're crossing over from aesthetic medicine more into medicine really, is medical weight loss. And my clinic's actually just started offering medical weight loss.
Okay.
And that is obviously something you only need to see a medical professional
Yeah.
for. There's a fantastic new drug which is licensed and is approved by NICE, but unfortunately the NHS can't offer it because of the cost.
All right. Okay.
As we're all seeing kind of the NHS budget being drained,
Yeah.
we're seeing tier 3 services vanish, and how NICE describes the tier structure of weight loss really, and weight loss and health interventions is the bottom. A tier 1 is a bit of lifestyle advice or a bit of diet advice in a conversation between a GP and his patient, or between a nurse and their patient, or kind of community health improvement workers, that kind of thing. Tier 2 is sort of more focused intervention, and then you're looking at things like, but not necessarily medical. You're looking at things like Slimming World and Weight Watchers and structured diets. Looked at by coached by somebody who knows what they're doing basically. Tier 3 is offering a higher level of care, so prescribing specific psychological support or advice. Talking about, giving a bit of coaching on increasing activity, and looking quite specifically on a one-to-one basis at things like diet and things like that. Then you move up to tier 4, which is bariatric surgery.
Yep.
So tier 3 services, and NICE really states in an ideal world, bariatric surgery should be preceded by 18 months to 2 years of medical weight loss, of tier 3 support. And unfortunately these services have just been eroded. So there are a few clinics now where people who have a lot of experience in that industry and are I know the gentleman who I trained with is actually an advisor to the NICE guideline, and is one of the country's leading experts on obesity and diabetes. So these people are training other health professionals in kind of the history of obesity, the etiology of obesity, and kind of dispelling a lot of myths, even from a health, but to be honest, from a health practitioner's perspective, some of the things that I learned, it dispelled things that I had thought were fact. As a medical professional, so it was very eye-opening, to be honest, how the research has come on and how complex kind of the issue of excess weight is phenomenal. And so there are health professionals around the country sort of who taking up this training, and who are qualified to supervise and coach and monitor and prescribe these medications. And this particular medication, my favourite of kind of the newer medications is it's been licensed for use in not insulin-dependent diabetics but type 2 diabetics for about 20 years.
Okay.
But it's been licensed specifically for weight loss in healthy individuals. Not healthy, that's not the right thing to say.
But no
non-diabetic individuals. Since 2017, so it's been licensed for 2 years, but unfortunately the funding just isn't there.
Yeah.
There are certain patients who it isn't suitable for, things like renal impairment, cardiovascular, kind of cardiac arrhythmias, that kind of thing. But on the whole, it's a really safe and effective drug. It can only be prescribed. Obviously, we have to be very careful, and this is where ethics is going to come into it. You have to be very careful who you're prescribing these things to. So you're not looking to prescribe to anybody who has a BMI of under 30 or under 27 with a comorbidity. So in terms of those kind of comorbidities, we're talking about things like high cholesterol, blood sugars that don't make them diabetic, but perhaps on the edge of, we're getting that way. People who are affected by the weight from a health perspective, those kinds of people you could treat from a slightly lower or something that puts them more at risk of developing cardiovascular disease and diabetes and things which we all know are heavily linked to carrying excess weight. Absolutely. So that's really exciting. I'm really excited about it. It's phenomenal.
There must be a lot of people who are crying out for those kind of treatments as well, especially
with the NHS funding being cut. Absolutely,
they're getting less and less resources, kind of thing, to be able to help with those prevalent issues. So, are there any groups of people or types of people that you were looking to have more of in the clinic, like either supporting the weight loss side of it, or are there any other areas that you would like to treat more people for specific treatments, etc.?
I think I'm really excited about the weight loss. I think this new drug just opens the door to helping so many people. So I'm really excited about it, and I want to get that across. If you're struggling with your weight, this new treatment is available, generally I like all my patients.
Always nice.
I think because when you're self-employed, you kind of have a bit of choice of and as a professional of who you work with and who you don't work with, and if somebody's not suitable for treatment, then they're not suitable for treatment. So, and I think because of the way I work as well, I always build a relationship with my clients. Nobody walks in my door and gets a treatment. It doesn't work like that in my practice. So we develop an ongoing relationship, really, and so I generally really get on with all of my patients. So it's really quite nice, and I enjoy it from a feedback perspective as well. When a patient or a client texts me and says, I'm so happy, this has bothered me for so long, and I feel so much better, thank you. It just makes my day, really, and I think that's why it's worth doing. So I think anybody who needs any help, either with whether they've got a skin problem, whether there's something that's bothering them, whether they're looking a little bit older, or whether they really need some help with weight loss and some professional support, then please come and see me.
So when we get people on the podcast, we ask everybody the same 3 questions. So the 3 questions in order are: firstly is, what does success look like to you? Because I'll go through the first 3 questions first, give you a second to think about
answers.
Because everybody's idea of success is different. We've had a million different answers. Some people have said it'll be, when I've done this, I've got that, or, when I can, everything's different, which we want to show people. The second is, have you ever had a failure, or at the time was seen as a failure or a setback, that's later led to success or put you on the path towards something better? And then the third one is one thing that you are obsessed by at the moment. And we've had TV shows, gadgets, things in people's industries, people have got hobbies like outside of work, that are absolutely, so a million different things there. So we'll start with the first one of, what does success look like to you?
To me, success is being able to take my little boy to school in the morning, go to work, look after my patients, and be able to pick my son up from school myself.
Yeah.
That's one of the main reasons that I've decided to commit to being full-time self-employed.
Yeah.
Just to have that improved quality time with my family and
Yeah.
quality of life with my family.
Yeah, that's a trend that we see a lot. Like, there's a lot of people who either want that, or they've specifically designed their business or their circumstances so they can spend more time with the family. There seems to be a big, not change, but consensus at the moment that a lot of people who are starting up businesses are doing it because they want a better family balance. You know, and they want it now rather than, well, if I work hard for 15 years, then I can take a back seat and spend time with family. They would rather start it off now. So it's great to see like so many people talking about it.
Definitely, from a historical perspective, my older children are much older. I'm actually nearly 40. I look quite young. I got ID'd in Morrison's the other day.
Always a compliment.
I know. In fact, I never drive a license, so I was mortified. Anyway, when you work for somebody else, and especially in the health professions and things like that, you lose a lot of time with your children, I think.
Yeah.
And I have a younger child now, and I think it's altered my perspective. I think when my other children were younger, I was sort of focused on my job, and I'm still focused on my job. But as having seen how much I missed out on for my children my older children when they were younger, it's definitely given me a drive to change that, because they're only young ones, and I can't, you can't wait 30 years because they're going to have grown up, they're going to have left home, and there's going to be nobody there for you to spend that time with, maybe grandchildren, hopefully. But you can't put these things off. If you want to make something happen, you have to make it happen.
Yeah, absolutely. So the second one was, have you ever had a failure or a setback that has actually put you on the path or led to something great or success or anything like that?
It's a bit of a weird one, really, because I always wanted to be a critical care practitioner.
Okay.
So, or an outreach practitioner, so somebody who is sort of more qualified than a critical care nurse, who are also very qualified. Believe me, it's really difficult. And I always wanted to do that. And I'd got the experience, and I'd worked in critical care, and I was looking at that in the future, keeping my eyes open for courses and things like that were going to get me in that direction. And then I think the setback I experienced really was things that started changing in the NHS, and the pressure that started to be put on us all. Staffing, things like that.
Yep.
And that led to me becoming very stressed and deciding to leave the NHS.
Yeah.
But actually, that's turned out to be a massive changing point in my life, because if I hadn't left that job and gone to work where I work now, I would never have become interested in aesthetics.
No.
Not a chance.
No.
I thought aesthetics was sausage lips and it would absolutely never have happened to me. And so moving there has just you meet someone and you find things out, and that's completely changed my life, because now I'm running my own business.
Yeah, that's phenomenal.
Yeah.
And then the third one is, what thing are you obsessed is a really a high word, but really into or very interested in, or anything like that?
At the moment, I would say it's not even on at the moment.
What?
I'm hopeless with the names of things as well. It's this television show, and there's the police of the police.
All right, okay. Yeah, like Internal Affairs or something like that. Yeah.
Oh, my husband will tell me straight away. Like, I'm so forgetful about things. Incredible mind for memories. It was up for an award yesterday against Game of Thrones and something else.
Was it on the BBC or something?
Yeah.
I think my wife watches it.
Line of Duty.
That's it.
There you go.
Thank you. Line of Duty.
There's the the man in the sky helping us. What it is.
Line duty, love it.
Yep.
Seen every when it's on, and
Yep.
we watch the reruns as well. Like we'll go back and watch old series.
Yeah.
When it's on, it's like it's a total obsession to
Yep.
us. And at the end of the last one, we were absolutely gutted. We're like, we need more. Why can't they just make it like EastEnders
Yeah.
so that
Just
it's on all
continues,
the time?
yeah.
Why do you have to wait for another series?
I
Because
know.
we love it.
It's a bit of that
So
anticlimax, isn't it, when it's over? You're like,
yeah,
oh.
because it's so unpredictable every time, and it's
Yeah.
so well made. I think with some of these shows, you get like you know what's going to happen, don't you?
Yeah, you
So,
can kind of see it coming.
But with that, it's always like you were never expecting it.
Yeah.
I love it, absolutely love it. Even though I can't remember what it's called.
Yeah. Well, you can now. You can always refer back to this podcast every time you get stuck.
Yeah.
So if anybody's been listening and wants to either ask you questions about treatment or anything like that, or come see you, where's the best places for them to get in contact with you?
So we have a Facebook page, Visage Aesthetics Clinic and Visage Medical Weight Loss Clinic. I'm on Facebook as well, Nikki Corrigan.
Yep.
We're based in Hartlepool Enterprise Centre, although we do run on an appointment-only basis. But we also have a website, www.visageaestheticsclinic.com, and our kind of telephone numbers there, email address, and they're all on Facebook as well. Just pinging a message is really quite easy, and I'm the one at the end of the line.
Well, we'll make sure that they're all linked in the description and everything as well, so people can easily get to them. So, thank you so much for coming on, Nikki.
Thank you.
Yeah. Thank you so much. It's been great to learn about all that kind of side of the business that I didn't have any idea on before.
Yeah, no, I don't think many people do. So
No,
a
no.
lot of it is about education. Really.
Yeah. Which is, we're happy to help.
Yeah, fabulous. Thank you.
No problem. So this has been episode 33 of the Teesside Business Podcast. The Teesside Business Podcast is promoted and produced by Person to Person Marketing. Thanks very much for listening.